Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about pain and discomfort on the lateral or outside part of your knee after knee replacement surgery. What causes this and what can we do to manage it effectively? Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos. So, probably the number one culprit, or at least the number one culprit we think to cause that pain and that discomfort on that outside part of your knee, that lateral part of that knee that kind of goes parallel to the rest of your knee joint, is your IT band or your iliotibial band. And your IT band, I'll share a picture up in the corner here, but it's this very thick and very wide, fibrous, tight band or tendon, or it's kind of a tendon, kind of a ligament that travels from your hip, kind of the front lateral part of your hip, and goes all the way down the outside part of your thigh, kind of spreads out very wide outside your thigh, and then attaches right at your knee joint. And this band is very thick, very fibrous, and it can get very tight. And there can be a significant amount of tension in that IT band. And there's a couple different theories of why your IT band can lead to some pain and discomfort. One theory is that with movements, with bending your knee, with moving your hip, it can cause some friction, some rubbing against the bones, against the other soft tissue around the knee or around the leg. And that can cause some of that pain in the lateral part of your thigh or the lateral part of your knee. Another thought is that the tension and tightness of the IT band actually causes a compression force. So what that means is it's pushing and compressing down on the surfaces underneath it. So if you think about having a rope or a rubber band, if you pull it really tight, that tightness causes it to flatten out and kind of push anything that's underneath it. So underneath that IT band is soft tissue, there's muscles, there's tendons, there's fat pads, and there's also blood vessels and nerves. And so that can cause some definite irritation or sensitivity if you're causing some pressure and tension on those nerves and blood vessels underneath the IT band. So why does the IT band, or why does the ligaments and the tissues on the outside part of your knee get really tight after knee replacement surgery? Well, when you have arthritis in your knee, arthritis is a degenerative disease. So it causes breakdown of the cartilage, and it causes a decrease in the fluid and the shock absorption in your knee joint. So what that means is the volume of your knee joint is actually decreased when you have arthritis. Because there's less fluid, because there's less cartilage, there's less volume, less space in that knee joint, and that's where you get that bone-on-bone phrase. So when you have a knee replacement surgery, your surgeon is going to go in there, he or she is going to improve the alignment of the knee joint, they're going to improve the spacing of the knee joint, and it's going to more resemble kind of a normal, healthy knee in terms of the space, in terms of the fluid, and just the general volume of that knee joint. So if you think about, you have a ligament or you have soft tissue that is on the outside part of your knee for many, many years, it's going to adapt and kind of shorten and shrink down as the knee decreases, the volume of the knee decreases with arthritis. Now, all of a sudden, after an hour or a few hour long surgery, that volume has increased significantly back to a normal healthy knee, and now that tendon or that soft tissue has been stretched very tight, has been stretched very taut after your surgery. So we need to give it time, essentially, to kind of adapt to its new length, its new positioning with the new prosthetic and knee replacement. Another thing to consider is just your general mechanics and movement after knee replacement surgery. You're probably going to be moving a little bit differently, and so moving differently at the knee due to pain, due to range of motion, due to weakness, and that's going to cause differences in how you move at your foot and your ankle, how you move at your hip, and all these things are interconnected, an interconnected chain of movements. Something going on at your knee is going to affect other joints of your leg and body. So what this means is that, again, your mechanics and your movement with certain things like walking, like squatting down or getting up and down from a chair are going to be a little bit different. and it might cause some increased tension, some increased tightness and stress, again, on that IT band, on those soft tissue, on those ligaments, on the outside part of your knee. So, what do we do with these different things to help manage this pain and discomfort on the outside part of the knee? Well, one thing is we just got to give it time. Like I said, that band, that soft tissue has been really tight for a long time, and now it's stretched out, and we just got to give it time to kind of adapt, to desensitize and stretch out and not compress as much on the blood vessels, on the nerves underneath it. Another thing we could do to help this along is with movement, activities, exercises. So as your body moves and your nervous system starts to adapt and the soft tissues start to adapt, you'll notice more and more that you're going to start to tolerate things, and that's because we're kind of retraining your nerves, retraining your nervous system, that it's not going to be as sensitized, not going to be as irritating to move that knee and to move your leg after surgery as the soft tissue adapts, as your body relearns movement. And what else we can do is just kind of stay away from things that are going to cause irritation, significant irritation. It's okay to have a little bit of pain and discomfort, but sometimes we overdo certain things. So we try to really stretch our IT band. We try to really, we massage it. We get the foam roller. We do all these things, and we're pushing and pulling and stretching and trying to make it feel better, when really doing all those things probably is actually causing some increased compressive forces and some increased pressure and stresses on that area. So like we said, a lot of the pain and discomfort is not necessarily from the IT band or the ligaments, but more so from the pressure on the nerves and on the blood vessels and soft tissue underneath it. So we don't necessarily want to put pressure and tightness and stretching and pulling and everything else on it. Rather, we want to adapt our movements. We want to try to decrease the stresses through having good mechanics and good movements as we're walking, as we're doing activities, and then just giving the body time, giving this connective tissue, the soft tissue, time to adapt and obtain a better length and alignment, so there's not as much pain and discomfort. So I feel like I'm rambling on and on here, but I hope you got some useful insights from this video that's going to help you if you're someone who's dealing with knee pain on the outside part of your knee. I'll try to share some pictures and videos throughout, some pictures in the corner throughout this video, so you can get a better idea of what different structures I'm talking about. Please, again, if you found this useful, I love your likes, your comments, and questions below. Be sure to subscribe if you don't already. I appreciate all of you, and thank you very much for watching.